live in Western Oregon. This is NBC 16 News at 5.
Good evening and thank you for joining us for NBC 16 at 5. I'm Jacqueline Mazer. On to some of the latest coronavirus headlines. There are more than 386,000 coronavirus cases in the U.S., according to Johns Hopkins University. The nationwide death toll surpasses 12,000. Lane County public health officials expect a peak number of cases in the next few weeks. Now looking at numbers here in Oregon, cases have increased to 1,183. The state death toll stands at 33. Washington, Multnomah, and Marion counties alone have a majority of cases. Taking a closer look at our region, Benton County stands at 21 cases. Lynn County still has the most cases with 45. Here in Lane County, we now have 32 cases. The newest cases are a man in his 60s from Eugene Springfield who is currently being hospitalized, and a woman in her 50s also from the Eugene Springfield area. She is medically stable at home. Deschutes County, meantime, has 44 cases. There are 12 confirmed cases in Douglas County. No one has tested positive in Coos County. Take a look at the bar graph on your screen showing the growth of positive coronavirus cases here in Oregon and how that number has grown in our state since March 10th. You can see there were just 19 positive cases statewide on that date compared to 1,183 cases as of today, just under 1 month later. Lane County public health officials expect a peak number of cases in the next few weeks. They're looking at projections based off patterns seen in other parts of the world. Lane County public health spokesperson Jason Davis says health officials are looking at models from Wuhan, China, Italy, and other countries. They're using these models to create projections for our area. They say models show countries have seen the greatest spike in cases of coronavirus around 6 weeks after their first cases started popping up. Davis says Lane County is 38 days out from the initial symptom onset of their first case.
If we're going to see the high number of cases, we can expect that to be happening in the next few weeks, and to brace for that. Hopefully, of course, the methods that have been put in place, both through social distancing at the state level and the requirements and guidelines handed down there, and then also the public participation that we've seen happen in our community, will pay dividends.
Measures have a positive effect, the peak could be far less severe. Ideally, the number of new cases will plateau. A Lane County building will now serve as a respite and recovery center for Lane County Public Health's coronavirus response. The building will be used for people waiting for coronavirus test results and for those who have tested positive. This space is for those who do not require hospitalization and do not have the resources to isolate themselves. Food and laundry services will also be available. The length of stay for each person will depend on their medical needs and conditions. The building was approved for purchase by the Lane County Board of Commissioners just last week. Well, starting this Thursday, passengers on LTD buses will have to wear a face mask covering their mouth and nose to ride. This rule will also apply to all LTD employees, including bus drivers. LTD's Assistant General Manager Mark Johnson says any CDC-approved mask or bandana will be enough. LTD has limited their routes and the number of people allowed on their buses. They are encouraging passengers to only use the bus if absolutely necessary.
People may be thinking, oh, those are kind of extreme steps. Extreme steps are exactly what's going to keep us safe and keep this from spreading. So, we're happy to be taking the steps that we're taking to ensure that people stay healthy.
Johnson says people without a mask will not be permitted to ride LTD buses. There's no set date for when this rule is set to end. Johnson says they're following the lead of local and state health officials. A 7-member team at the University of Oregon's Technical Science Wing is busy producing clear face shields to protect doctors, nurses, and other frontline first responders. For the past week, managers say the team has fabricated about 300 of the shields, with 100 already sent free of charge to Peace Health.
We can make about one every 4 or 5 minutes, so really a high throughput method to make these face shields that are made of high quality materials that can be sterilized.
Blue says the shop is stockpiling enough materials for a second run of the face shields. They're made out of polycarbonate material cut into shape by using a water jet cutter. Well, testing capabilities for coronavirus are in high demand across the nation. Oregon State University is helping to expand testing in a big way, providing a critical piece of the testing process for hospitals. Our Kelsey Christensen is following this story, working from home like many of us. She joins us live tonight with her kitty cat. Hey, Kelsey.
Hey, Jacqueline, that's right. You're probably wondering why I'm out here with my cat Cheaty, but that's because this whole story starts with animals. That testing component was actually found in Oregon State University's Animal Diagnostic Lab, and that could help a lot of people testing for COVID-19 in the near future. Inside this Oregon State University lab lies a critical component for coronavirus testing. This clear liquid may not look like much, but even this small amount could expand coronavirus testing in big numbers.
This particular medium is something that we make all the time.
OSU researcher Justin Sanders says this element is something called virtual transport medium, or VTM. Here's why it's important. After a swab sample is collected during the COVID-19 testing process, it needs to be transported to a lab for testing. The thing is, the samples are very fragile, so the VTM acts as a preservative to make sure the sample stays intact until it reaches the lab.
Without this, their samples cannot be adequately preserved during transport.
And surprising to some, this VTM comes from OSU's Animal Diagnostic Lab, meaning it's typically used for animal virus testing. But don't worry, it's the same medium used for both animals and human testing. And the reason this animal lab is helping out is because hospitals just need more of it.
Hospitals really don't have the capacity to make it from scratch.
Sanders says hospitals across Oregon and even some on the East Coast are asking for VTM by the leaders. So much, in fact, that more OSU researchers are hopping on board. Sanders says 3 liters of this stuff can preserve around 1,000 tests. But given that VTM is just one component of testing, Sanders says another bottleneck in the process is the amount of swabs, another item in high demand amid the pandemic. So stay with us. In our next half hour, we'll tell you how much VTM, that preservative, that OSU thinks it can make going forward. Jacqueline?
All right, sounds good, Kelsey. Thank you so much. Stay safe out there.
Well, Mother Nature did it again across Western Oregon, giving us plenty of sunshine and those spring-like temperatures continuing. Here's a look at some of the numbers across our area, some of our biggest cities. Not necessarily record-breaking, of course, those are the numbers on the bottom row, but still, nonetheless, it was very nice and mild out there. Radar and satellite over the past several hours shows clearing conditions and nothing but blue skies and sunny conditions across our area on this Tuesday afternoon, but temperatures sliding back into the upper 30s tonight, still remaining clear, and the sunshine continues tomorrow, and that's going to lead way for a spectacular viewing opportunity tonight. It's the full pink supermoon, of course known for its color pink because it is the spring flowers that give it that name. I'll go ahead and talk more about our extended forecast in just a few minutes.
Very cool. Thank you, Josh. All right, we're now 2 days into the week projected to be a peak for coronavirus cases, but there is still growing questions about where the virus will strike next. Alice Barr is in Washington with the latest.
In the two-front war to save lives and rescue the economy, the Trump administration under mounting pressure to get help where it's needed most, amid signs that hospitalizations may be stabilizing in New York, growing concerns that rural communities are about to see their own surge.
Most of the rural hospitals don't have an ICU. They do not have a ventilator. And if they do have a ventilator, which will breathe for the patient, we don't have the staff to man the ventilators.
And new data shows African Americans are getting sick and dying at higher rates.
Number one, people unfortunately are more likely to be of low socioeconomic status, which makes it harder to social distance. Number two, we know that blacks are more likely to have diabetes, heart disease, lung disease.
On the economic front, President Trump touting the new Paycheck Protection Program to save small businesses, even as it struggles to keep up with overwhelming demand and overcome technical glitches and confusion. President Trump acknowledging the program's $350 billion may not be enough.
We just asked Congress to pass legislation to fund an additional $250 billion for Paycheck Protection Program.
At the same time, the Trump administration facing new scrutiny over a top White House advisor's memo that reportedly warned back in late January the coronavirus crisis could cost the U.S. trillions of dollars and put hundreds of thousands of American lives at risk. It came as President Trump was still publicly downplaying the risk. In Washington, Alice Barr, NBC News.
Long lines in Wisconsin as voters head to cast their votes. Wisconsin's primary comes after 2 courts ruled the election could not be postponed. There are 84 pledged delegates at stake. It is still too early to project a winner. So far, former Vice President Joe Biden has 1,217 delegates, and Senator Bernie Sanders falls behind with 914. 1,991 delegates are needed to win the Democratic nomination. Polls close in less than an hour. Oregonians have 3 more weeks to register to vote in next month's presidential primary. April 28th is also the party choice deadline. Remember, Oregon has closed primaries, so you have to be registered as a Democrat or Republican to cast your ballot. Ballots are scheduled to go out to voters the last week of this month. To prevent the spread of the coronavirus, remember, do not lick your ballot when you're sealing it. You can use a damp cloth instead. Election Day, meantime, is May 19th. Wednesday night begins the start of the Jewish holiday of Passover. And to adjust to the new normal during the pandemic, local organizations are helping people find ways to celebrate at home. Temples such as Temple Beth Israel are offering online services where you can follow along from the comfort of your own home. They will host a virtual Seder starting at 5:30 p.m. on Zoom. If you want to join in, you can still sign up. The deadline to get the Zoom link is tomorrow at 2 p.m. Student services like Hillel will also be offering virtual Seders for the University of Oregon and OSU. If you're looking for some matzo ball soup for your Seder dinner, you can get last-minute meal additions delivered from Hillel. If you run out for some last-minute groceries, make sure to wear a mask and stick to the 6 feet apart rule. Well, for the latest information on the coronavirus, make sure to visit our website, NBC16.com, our Facebook page at KMTR News, and download our app, KMTR News, on your mobile device. We have resources to keep you and your family safe and healthy. Coming up next on NBC 16 at 5, business owners struggle with the effects of the coronavirus pandemic. What plans lawmakers are considering in another relief package. Plus, gun sales have seen a spike since the coronavirus pandemic started. One Roseburg business owner shares his experience.